We chose to do the journal enhancement project. It's been a bit of a journey over the number of years. We have often discussed how it is we want to communicate to our caregivers about the type of day their family member had at our program. We know it's really important for the caregivers to know, how much time they spent, whether they ate, whether they used the washroom, whether they had a chance to talk to people and perhaps play a few games of bingo or basketball toss. And it was very difficult for us to find a way that was efficient, that was clear, to get this information to our caregivers. We had a daily journal entry or filled with anecdotal information that we used to give to the caregivers. But we found that sometimes we just didn't have the time to accurately get all the information we needed, and then the time to fill out this journal entry in an efficient way.
So thanks to the OCSA Learning Lab opportunity a year ago, we were able to learn a variety of tools, problem-solving tools, root cause analysis tools, to help us in our journey, and we could not have done it without that opportunity. We brought together a team from across the department, and we were able to utilize these tools to make sure that we were identifying the real root causes of why the satisfaction of our journals was declining. And we realized that we really needed to change the template for our client journal, and the best way that we knew how was to involve our caregivers in helping us develop that new tool. We brought together, I believe it was 5 caregivers for a focus group and asked them their opinion of the current journal. What did they like? What didn't they like? What did they want to see from us? What kind of information did they want to see? And we were quite surprised because they completely changed the format. They wanted a quick scale. They didn't want anecdotal. And it gave us an opportunity to really engage them in the project to make sure that we were truly meeting their needs. We were able to use a scale that Maureen and the staff use in other elements of the programming to make it more efficient for the caregivers. We were able to increase satisfaction dramatically among the caregivers, give them the information they truly needed. It reduced the amount of time that they needed to take to get that information with the simple numbers and the scale. They weren't reading volumes and volumes of information, so they were reading it more often, they were benefiting more from the information. On a staff perspective, we were able to complete the journals more quickly, which meant that there was more time being able to be devoted to frontline care with our clients, and we also saw a dramatic decrease in the number of errors that were being made. So all in all, it was a wonderful opportunity for the staff, for our caregivers, and we were very pleased with the end product.